And I walked into the anatomy lab and I could see everybody else just walked away.
Your first thought about being a doctor as a kid was visiting an anatomy lab at a medical school in the Brazilian countryside. What did you see there that fascinated you?
So it was really an interesting experience at the age of 8 to walk into the anatomy lab of a medical school, and it was a fun day for me as well. It was the first time that I got on a plane. It was a small single engine and propeller flight with my father. That was the beginning of thinking about science and thinking about nature, the human body, and then gradually moving to biology, and the rest is history.
Sure. In the United States, you've helped create national guidelines for the treatment of breast cancer. How does it feel to see your work implemented so widely?
It's very gratifying to be able to influence on how care is not just provided to a small percentage of the patients that participated in studies, but how you can kind of raise the tide and lift all the boats and make sure that new knowledge is translated as much as possible to every single patient and reduce barriers. So it's pretty neat. I view taking care of patients, number one, as a privilege. And as I remind my colleagues all the time, even in a busy day in clinic when I'm seeing dozens of patients and I have a limited amount of time, I have to remind myself that one patient, that one family waiting to see me may have waited to see me for a month or for a longer period of time. So it's almost as if before I walk into the room, I kind of pause for a second or two, almost like to reset and try to empty my memory bank for a moment so I'm not overloaded with information, and walk into the room and be able to focus on that patient, on that family, and listen. And one of the things that I do with patients at all, when I walk into the room, for the first minute or so, I just listen. I just kind of let them tell me what brings them to see me that day, what do they want to accomplish from that visit. And for me, at the end of the day, that's one of the things that I enjoy the most about the work that I do, is the ability to mix taking care of patients, which then allows me to figure out exactly what's important for them, what matters, what are the clinical issues, and that experience influences my research in such a vivid way, because when I start thinking about clinical questions, clinical research, how we're going to be spending limited resources, I can, for the most part, try to focus on hopefully things that it will matter.
Okay, Dr. Wolff, thank you so much for your time. That was a CLOSLER look.